Results is sponsoring this healthcare reform public forum, which is hard to say. Reform and forum just shouldn't go in the same sentence. But Results is about two things. It's about one, creating the public will to end poverty and hunger. And number two, to empower individuals to have breakthroughs in exercising their personal and political power. And I can attest to that second one. I asked Senator Harkin face-to-face for $300 million for the Global Fund to fight TB, AIDS, and malaria. Once you've asked a senator for that amount of money, you're not afraid to ask anybody for any. Specifically, what I'm looking for tonight is to find out what we need in eastern Iowa from a healthcare reform system. This I would like for us to read together. This is a quote from retired Senator Mark Hatfield. "We stand by as children starve by the millions because we lack the will to eliminate hunger. Yet we have found the will to develop missiles capable of flying over the polar cap and landing within a few hundred feet of their target. This is not innovation. It is a profound distortion of humanity's purpose on Earth." Results was founded by Sam Daly Harris in 1970. He came to the realization that hunger could be ended in his lifetime if we created the political will to do that. When I first came into Results, I heard that and I thought, now wait a minute. Now I'm a Christian, so I said to myself, Jesus said, the poor you will always have with you. That can't happen. And then I said to myself, but wait, this is the way the church and the governments have always been doing things. They've always been doing things the same way, and we've always had poverty with us. If we can do it a different way, we can eliminate poverty, and we can eliminate it in our lifetimes. And that is what Results believes in. What we do in Results is 2 hours a month. On the third Monday of the month, we get together for education and action meetings. And tonight is our regular Results meeting. So if you were free to come on the third Monday of the month in April, you're free to come to Results meetings. We also get together on the second Saturday of the month, and we listen to national conference calls. So in 2 hours a month, you can make a difference in people's lives. Results believes in 5 different core values. Number 1 is individual transformation. Number 2 is ongoing learning, and tonight we are fulfilling core value number 2. Number 3 is taking action. When we get done with the panelists tonight, we are each going to take action, and it's not going to hurt a bit, I promise. Number 4, powerful relationships and community. The Cedar Rapids Results Group is very proud of the relationships we have with the media, with our members of Congress, and with other groups within the community. And finally, empowering citizens. It's time for us to take our democracy back, and as citizens to be empowered to have a voice in that. We're very proud that in February, President Obama signed the CHIP legislation, which has been changed to Children's Health Insurance Program. It used to be State Children's Health Insurance Program. You've heard of SCHIP. They now call it CHIP. Why should anything be easy? Let's change it. Whatever. At any rate, we were very pleased to see that President Bush had vetoed that legislation twice. Now it is, in fact, a law. It's an active program, and has provided health care to an additional 4 million children in the country. Next slide, please. Results volunteers also worked hard in the late 2008 and early 2009 campaign to ensure that the current healthcare safety net is maintained and strengthened. And that's going to be what we focus on tonight. There's legislation pending in Congress, and we're going to work on a piece of legislation that is live and real, and we can do something about tonight. And now it is my very great pleasure to introduce to you our moderator for this evening. She is a good friend of mine. She is an important, valuable member of the Results Group. She's one of the princesses for bread buttering, one of our one of our fundraisers. She's a retired educator and just an all-around wonderful, wonderful person. And I want to thank her for all her work tonight. Ladies and gentlemen, Leslie Sandberg.
Thank you.
Thank you. Yes, I used to work for Grantwood ADA, and I used to get a paycheck every month. Now I get a bill every month for additional health care insurance. So this is a very good topic for us tonight. Welcome again on behalf of Results, and hopefully you all learned a little bit about Results tonight, even those of us that are members and fairly regular. So thank you, Diane, for all of this arrangement. You've done well. So here's how we're going to operate tonight. I'm going to first of all introduce our panelists, and then they are each going to respond to a question that's printed on the inside of your leaflet. And then we'll go to the second question and have them each respond, and then the third. Each has maybe a few introductory remarks that they perhaps have prepared as well. And then we will take your questions. So as they pop into your mind, please write them down. We'll see how many we can get through. So let me introduce our panelists. To my left, this is Larry Donaldson from Mercy Hospital. He is the Senior Vice President, Managed Care, Mercy Medical Center. Next is Rebecca Dunk, Senior Manager, Health and Welfare Benefits with Aegon USA. Next, a little bit out of order, Kirsten Running-Marquardt, who is a District Representative for Congressman Dave Loebsack, a congressperson to whom we have written many letters. Next is Dr. Beth Robbins, who is a psychologist with St. Luke's Family Counseling Center. And on the very end is Darlene Schmidt, who is a nurse, CEO and Clinic Executive Director of the Community Health Free Clinic here in Cedar Rapids. So this is our panel. Why don't you join me in welcoming them tonight? All right, shall we start on this end with Larry and ask you to make an opening statement, whichever you'd like to do, and then respond to question number one. What are the problems your sector faces under the current healthcare system?
To give you some perspective on what I do, Senior Vice President of Managed Care probably doesn't mean a whole lot to a lot of people here, but essentially what I do is I negotiate the contracts with the payers for the hospital and for the physician networks, so that basically we set the fee schedules that pays all the physicians in Cedar Rapids and the hospital. I don't negotiate Medicare. Medicare tells us what they're going to pay us. So does Medicaid, by the way, but everything else I negotiate. I have a few comments that relate to what I call health security, and I think this might be apropos to what